In 2011, I came on board with the University of Auckland as part of Professor Ross Lawrenson's team, and we were tasked with looking at PSA testing across the Midland region and really have an understanding of the frequency of testing and the outcomes for those men who had a positive PSA test result. It became clear that there was a need for more of the research component to be undertaken. I was involved in various aspects, including supporting PhDs that we had on the project, and also I was very fortunate in that I was able to work with interviewer-assisted questionnaires with both patients and partners for that study. And it really grew my interest in how I could look at patient-reported outcome measures and experience measures, including satisfaction, across different cancers. This has become a part of what I do in every research project that we move into. More recently, we've been looking at the Auckland and Waikato breast cancer registers, and there's been a clear need for an understanding of women with breast cancer who have Pacifica ethnicity, and just trying to understand their stages at diagnosis, what their management is, and certainly what their outcomes are with the disease. I have a series of 4 papers looking at increased risk of having an advanced diagnosis for a Pacific woman compared to a New Zealand European woman, and looking at what factors contribute to her increased stage at diagnosis. One of the important factors that we found when we looked at survival for Pacific women and compared that to New Zealand European was a substantial difference by stage. For Pacific women compared to New Zealand European women, they do worse from stage 1 to 3, except in stage 4, where surprisingly we found that Pacific women do better than New Zealand European women. So they have a better outcome for a worse stage disease. While I can report on that, there's really nothing that tells me why that's occurring. So a big part of my future research is to be able to understand that disparity. There is a hypothesis that there's outmigration, so they're leaving the country once they have this diagnosis, but this has never really been proven.